this section, Dr. Narasimha is talking about mechanism behind withdrawal symptoms as well as the nature of benzodiazepine withdrawal symptoms. Let's listen to Dr. Narasimha.
So coming to the neurobiology of withdrawal, the basic problem with why withdrawal symptoms happen is over a period of time tolerance develop. As tolerance develop, a lot of neuroadaptation happens. Once a person stops benzodiazepine, which unmasks the drug-induced neuroadaptations, which causes withdrawal symptoms. Basically, the withdrawal symptoms is because of underactivity of GABA and surge of glutamate or positive CNS activity. And these adaptations, you have to know that these adaptations are very slow to recover. That is, these do not recover. Sometimes it takes a very long time, that is maybe months, or sometimes it also leads to protracted nature of withdrawal symptoms. Maybe on day 1, day 2, you may not see withdrawal symptoms, but it starts from day 3 and it can continue for months together. So what are the withdrawal symptoms? So if you see faster acting, if you see short, there is a difference between onset of withdrawal symptoms. That is, with respect to shorter acting agent, these withdrawal symptoms start very fast, that is 2 to 3 days, and longer acting agents take a fairly longer time for onset of withdrawal symptoms. And most withdrawal symptoms are because of, as I already told, brain hyperexcitability. And withdrawal symptoms can be classified into physical, psychological, and sensory symptoms. And mildest form of withdrawal symptoms is rebound symptoms. That is, a person has been given medication for sleep, he might have insomnia. If a person has been given medication for anxiety, he might have rebound anxiety. So the most common physical withdrawal symptoms are muscle tension, weakness, spasms, pain, influenza-like symptoms like sweating, shivering, pins and needles. And most common psychological withdrawal symptoms include anxiety, panic-like symptoms, restlessness, agitation, depression, mood swings, other psychovegetative symptoms like tremors, reduced concentration, sleep disturbances, nightmares. And there are other symptoms like appetite loss, tachycardia, blurred visions, which are not very common but can be seen. Apart from that, there can be perceptual abnormalities like hyperacusis to photophobia to dysesthesia, and people can have symptoms like seizures, which are again can be life-threatening sometimes, and which requires intensive management. There can be symptoms of delirium or minor perceptual abnormalities like hallucinations, depersonalization, and sometimes paranoid thoughts. There are certain set of symptoms which are slightly more characteristic of benzodiazepine withdrawal. When you see patients with benzodiazepine withdrawal in comorbidity with alcohol withdrawal, in comorbidity with opioid withdrawal. So how do you differentiate some of these symptoms when compared to alcohol withdrawal or general anxiety symptoms? So some of these symptoms, like which is on the right side of the screen, like benzodiazepine withdrawal usually have some of the symptoms like muscle twitches, jerks, fasciculations, tinnitus, and some of these perceptual abnormalities like distortion of body image, tingling, numbness, altered sensation. So the symptoms on the right side seems to be more characteristic of benzodiazepine when compared to general anxiety-like symptoms.
The benzodiazepines has a varied half-lives, and as per that, withdrawal symptoms emergence also changes. Drugs like long half-life like diazepam, chlordiazepoxide, not only the half-life is long, but also the metabolites stays in the body for longer time compared to shorter short half-lives like lorazepam and oxazepam. Let's come back to the revision of this part. The following statement is true or false. First, symptoms of withdrawal after long-term benzodiazepine use usually develop faster with shorter acting agents. Which of the following symptoms are relatively specific to benzodiazepine withdrawal? So here you can think of multiple symptoms. Those are specific to benzodiazepine withdrawals. Thank you.